Good morning, everyone, and welcome. I'm Dr. S.K. Singh, and I'm delighted to have you here today. We will be exploring the fascinating topic of classification of sterilization methods. This presentation will cover different approaches used to achieve sterilization, their applications, and how they are categorized. I look forward to sharing insights with you and engaging in some meaningful discussions. Let's get started. Let's talk about the importance of sterilization. First, it plays a crucial role in preventing cross-infection during medical procedures. By ensuring that all instruments are properly sterilized, we reduce the risk of transmitting harmful microorganisms from one patient to another. This is essential for patient safety, as it helps protect individuals from potential infections. Sterilization is especially critical for certain medical devices like surgical tools and implants, which come into direct contact with sterile tissues or the bloodstream. Failing to sterilize properly can have serious consequences, including the transmission of diseases or infections during surgery. Now, to clarify, sterilization means the complete elimination of all microorganisms, including spores, which are particularly resilient. This process is vital in healthcare settings, such as hospitals, pharmaceutical labs, and research laboratories, where preventing healthcare-associated infections is a top priority. And a quick regulatory note: sterilization is defined as the destruction of all microbial life, whether through physical methods like heat and radiation or chemical methods. This comprehensive approach helps ensure the safety and effectiveness of medical procedures and products. Let's take a look at physical sterilization. Overview. This method uses physical agents to destroy microorganisms, which is essential for ensuring our environments and materials are truly sterile. Some of the main techniques include heat, which can be moist or dry, radiation, and filtration. Among these, moist heat is generally considered the most effective physical method because it penetrates well and destroys microorganisms efficiently. Now, when we talk about sterilization methods, they can be broadly classified into physical methods and chemical methods. Each has its own applications depending on specific needs. Choosing the right sterilization method depends on several factors. For example, the nature of the material you're sterilizing is crucial. Some materials can withstand heat, others can't. Heat sensitivity is another key consideration, because some items might be damaged or compromised if exposed to high temperatures. And finally, the type of microorganisms you're targeting also influences the choice of method, as some microbes are more resistant than others. Understanding these factors helps us select the most appropriate and effective sterilization technique for any given situation. Now, let's talk about moist heat sterilization, also known as autoclaving. This method uses steam under pressure to achieve sterilization. The standard conditions we typically follow are 121 degrees Celsius for about 15 to 20 minutes. The main mechanism behind this process is protein denaturation, which effectively destroys microorganisms. Regulatory guidelines actually favor steam sterilization as the preferred method, especially for critical instruments that need to be completely sterile. For example, surgical instruments and culture media are commonly sterilized using autoclaving because it ensures thorough decontamination. So, in essence, autoclaving is a reliable, efficient way to ensure that essential medical tools and media are safe and sterile before use. Let's talk about dry heat sterilization. This method uses hot air, typically in the range of 160 to 180 degrees Celsius, to achieve sterilization. The key mechanism here is oxidative damage, which essentially destroys microorganisms by damaging their cell components through oxidation. There are a couple of common methods for dry heat sterilization. One is the hot air oven, which is widely used in laboratories and hospitals. The other is incineration, which is often used for waste disposal or materials that can withstand high temperatures. Now, when we think about what items can be sterilized this way, glassware and metal instruments are perfect examples. They can withstand the high temperatures without being damaged, making dry heat sterilization an effective choice for these types of materials. Overall, dry heat sterilization is a reliable method, especially for heat-resistant items, and it plays a crucial role in maintaining sterile environments in healthcare and laboratory settings. Let's talk about radiation sterilization. UV radiation is primarily used for surface sterilization, meaning it's effective for disinfecting the outer surfaces of items. On the other hand, ionizing radiation, such as gamma rays, has a much deeper penetration ability, allowing it to sterilize the interior parts of products. Some common examples include disposable syringes and surgical gloves. These are often sterilized using gamma rays because it ensures thorough sterilization without damaging the materials. This method is widely used in the industrial sterilization of medical products because it's efficient, reliable, and can handle large batches. It's a crucial part of ensuring safety and sterility in healthcare settings. Overall, radiation sterilization plays a vital role in maintaining high standards of hygiene and patient safety across the medical industry. Now let's talk about filtration sterilization. This method removes microbes using membrane filters, which are essentially tiny barriers that trap microorganisms as liquids pass through them. It's particularly useful for heat-sensitive liquids, meaning substances that could be damaged or altered if exposed to high temperatures. You'll often see this technique used with vaccines and antibiotics, where maintaining the integrity of the product is crucial. What's important to understand is that this process doesn't kill the microbes. Instead, it physically removes them from the liquid. So, in essence, filtration sterilization is a mechanical way of ensuring safety and purity without relying on heat, making it ideal for delicate substances. This method ties into our overall theme of different sterilization techniques tailored to various needs and sensitivities. Liquid chemical sterilization involves using strong chemical solutions to effectively destroy microorganisms on various surfaces or instruments. Some common examples include glutaraldehyde, hydrogen peroxide, and peracetic acid. These chemicals are powerful, but one important thing to keep in mind is that they require a relatively long exposure time, anywhere from 3 to 12 hours, to ensure proper sterilization. Chemical sterilization, in general, refers to the use of chemical agents to eliminate all forms of microbial life. It's especially useful for items that can't withstand high heat or steam sterilization methods. This method includes both liquid chemicals and gaseous sterilization, giving us flexibility depending on the material and situation. Overall, chemical sterilization plays a crucial role in maintaining safety and sterility, especially in scenarios where heat-sensitive materials are involved, aligning with our goal of safe, effective sterilization methods across different medical and laboratory settings. Let's talk about gaseous sterilization, which is particularly useful for delicate and complex equipment that can't withstand high heat or moisture. This method involves using gases to sterilize items effectively. The most common gases we use are ethylene oxide, often called EtO, and hydrogen peroxide vapor. These gases are excellent choices because they can penetrate into hard-to-reach areas and ensure thorough sterilization. Gaseous sterilization is especially recommended for heat-sensitive devices, meaning items that could get damaged or deform if exposed to high temperatures. For example, plastic instruments and endoscopes are perfect candidates for this method. They're delicate, complex, and require a gentle yet effective sterilization process. So, in the context of our overall sterilization strategies, gaseous sterilization fills an important niche by allowing us to sterilize sensitive equipment safely and efficiently. Now, let's talk about some important regulatory considerations. First and foremost, always follow the manufacturer's instructions carefully, paying close attention to the recommended time, temperature, and concentration settings. These guidelines are designed to ensure effective sterilization and safety. Next, it's crucial to use monitoring systems throughout the process. Mechanical indicators are a good starting point, They show basic information like whether the cycle has run. Chemical indicators are also essential. They change color or display markings to confirm exposure to sterilizing conditions. However, the most reliable method by far is using biological indicators. These involve using resistant spores that can withstand sterilization processes. If these spores are killed, you can be confident that the sterilization was effective. Overall, integrating these monitoring techniques helps us stay compliant with regulations and, more importantly, ensures the safety of patients and staff. Remember, thorough monitoring and adherence to guidelines are key to successful sterilization practices. Let's take a closer look at the comparison between physical and chemical methods. When we talk about physical processes, we're referring to changes that affect the form or appearance of a substance without altering its chemical composition. For example, cutting, grinding, or melting are all physical changes. They don't change what the substance is at the molecular level. On the other hand, chemical methods involve transforming a substance into a different substance altogether. Think of reactions like combustion or corrosion. These fundamentally change the chemical structure. One key point to remember is that physical changes are usually reversible. You can often restore the original state, like freezing water to get ice. Chemical changes, however, are typically irreversible because new substances are formed. Understanding these differences is crucial because it impacts how we handle, process, and utilize materials in various industries. It also ties back to our overall theme of how materials behave and change, whether through physical manipulation or chemical reactions. So, recognizing whether a change is physical or chemical helps us predict the outcome and decide the best approach for our specific needs. Sterilization is absolutely critical for infection control. It's the key step in ensuring that any tools or materials used are safe and free of harmful microorganisms. There are two main approaches we typically consider: physical methods and chemical methods. The choice between these depends largely on the material we're sterilizing and the specific application. For example, some materials can withstand high heat, making physical methods like autoclaving ideal, while others might be sensitive and require chemical sterilization. It's also very important to follow regulatory guidelines throughout this process. Doing so not only ensures that the sterilization is effective, but also that it remains safe for both patients and healthcare workers. In conclusion, selecting the right sterilization method and adhering to established standards is essential in maintaining a safe environment and achieving the best outcomes. This ties back to our overall goal of providing safe, effective healthcare through meticulous infection control practices. For further support, please don't hesitate to reach out. We're here to help you implement what you've learned today and answer any questions you might have. Remember, the key is to take the information and apply it confidently. If you need assistance, contact details are provided, so feel free to get in touch. Thank you so much for your attention and engagement throughout this presentation. We appreciate your time and look forward to supporting you moving forward.